Alliance Live. Self-Management Fund. Resilience, Recovery and Development. What have we learnt? Dr. Anne Williams, Nurse and Trustee, Talk Lipoedema.
My name's Anne and I am part of Talk Lipoedema. I'm actually a nurse by background, but I've been working with Talk Lipoedema for probably about 7 years now. And what I'm going to do is tell you a little bit about the project that the Alliance have funded that is a peer support project. And I'll tell you a bit about what we feel we can learn from that so far. So I thought it might be useful to even start by telling you a bit about the organisation, because I'm here in my capacity as a trustee, and I'm the only trustee on the board at the moment who doesn't have lipedema. So it's important to let you know that the organisation was started and is really led by people with lived experience of lipedema. And it was started in 2014. And it's gradually going from strength to strength, and funding recently from different funders, and particularly the Alliance, has allowed us to really think a bit more about what we're doing and to develop what we're doing, because we were really started as a peer support organisation, but it was quite ad hoc to start with. And this project has allowed us to start thinking about how we will do that in a more systematic way and evaluate what we do. So lipedema, I've put some pictures here because it's not a very well understood condition. It's a fat and connective tissue condition that mainly affects women, not exclusively, but it leads to changes in body shape. And there's quite a lot of evidence around the mental health and emotional challenges, the chronic pain that people have with lipedema. And actually one of the real big problems is that healthcare professionals and others don't recognise lipedema, think it's something else, and people live for many years without a diagnosis or with a wrong diagnosis. So we were really set up to try and improve this situation. And so our overall purpose is to support and empower people living with lipedema, and also to work with professionals to increase awareness. So that's where my work has come in. So in the past, we've done a lot of online and face-to-face support, particularly online through social media, roadshows. We've developed a self-management group program, done various online events and conferences. But as I say, what we were really interested in is the essence of what we wanted to do was that peer support and how we could do that better. So we applied to the Alliance, and we're very fortunate to be awarded the money to do this. And it really is a natural progression from our current work, as I said. And the overall purpose was to develop and evaluate a peer support programme to enable people living with lipedema to make positive changes to their life and improve their health and well-being. Because like a lot of conditions, people with lipedema are often not sure where do they go if they get firstly, maybe not get a clear and accurate diagnosis, but then once they do know they have a condition, where do they go for support? And we knew that peer support was really important within that kind of pathway, because the NHS services, for example, are still quite limited. So the project that we've done is that we started in October is in 3 phases, and we're in phase 1 where we're doing a lot of the development work. And then we're going through into phase 2, which is when we'll be doing the training of the peer supporters, and then running through to the actual building of the programme and evaluating that. So people with lipedema are very much involved in the design, delivery and evaluation of the project. So what we wanted to do in this first phase is involve people that were relevant to the project, but also involve people, professionals who could help us develop the evidence-informed kind of information that we needed to support the project. So I'm going to just tell you a bit about our visioning event that we ran. And I'm sure you all, probably your organisations do similar things. So I'd be quite interested to hear from yourselves as well about this, and any information on how you found these things to be, most successful. But what we did was we brought together, it was on the 7th of January, and I must admit, it was a Saturday after Christmas and New Year. And I thought, is this a good time to get people? I'm not sure if it is. Maybe they need to get out the house and they want to get going again, or maybe they just are still in that kind of holiday mode. But in actual fact, everybody that we invited, there was 16 people came along. They all came, and we had a really successful visioning event that we held in Edinburgh at the Training and Conference Centre. So I've just got a few photographs here to show you, but what we did, we had a half day, we kind of lunch and half day event where we brought together people with lived experience of lipedema and professionals. So that included people who, a psychologist, a nurse, physio, doctor. We had also dietitians, nutrition therapists, alongside people with lipedema who had a whole range of different skills themselves. So you can see a little bit of a snapshot from today. And what we did was we gave a bit of a sort of introduction, and then we divided people into groups, and you can see people working away in different groups there. And also we had a mix of professionals and people with lived experience in the groups. And then we also had some activities where we had people kind of looking at, as you can see, there's posters on the wall. And I was just going to show you, this was one of the examples where we got people to think about the journey of peer support. So the purpose of the day was to look at, well, what do we understand by peer support? Because people have different understanding of peer support, which we discovered. What would the experience or the journey of peer support look like for the person with lipedema? And also, what resources did we need? We were really interested in that. So it's not the best drawing that I did there of a kind of pathway or a journey, but actually you can see how people engaged, and we gathered quite a lot of information about that. So in terms of our learning, we found it was a really exhilarating experience on all sides, really. We had a great sort of evaluation from this, but also got a lot of information that we need to build this project, rather than just plucking our ideas out of our own heads. We've now got a whole range of people who are part of a steering group. So people were really willing to come along, but we realised that the day needed to be carefully planned, which we had done. And also the communication with people, I think, meant that people knew that they were valued, and they came along to the day, perhaps on a Saturday when they might not feel like coming. And so what we did was a mix of group work and other activities that you can see. So we also had arranged the groups so that we had mixed certain people together in the groups. So we preempted that a bit, although we did invite people to change if they wanted to, but the groups seemed to work really well. But one of the things that we learned was that peer support meant different things to different people. And some of the people on the day saw it very much as a group thing, whereas as an organisation, we were thinking of it as one-to-one. So this was quite helpful to start thinking about really what other people understand by peer support. We got some really good ideas for the peer supporter training, which we're now busy developing with a trainer who was actually on the visioning event. One of the things that we learned was that there are probably quite a lot of resources that we do need to develop. And we sort of knew that already, but that this is going to take time, and we need to sustain the momentum and the communication. So we're thinking about how with the group to keep people on board. That we also realised that we might need more resources, because when we looked into what we've identified in terms of how we will do this support program, peer support program, we realise that we may need more, particularly in terms of other staff, because we're a really small organisation. So we're starting now to think about where we need to look for funding for other staff. We've realised how crucial this could be to what we do. We also found that the day was really good in terms of evaluation opportunities, and when after doing the Evaluation Support Scotland course just before Christmas, that was kind of in my mind as well, in our minds. And these are some of our outcomes, our main outcomes for the project. And so, for example, we found that some of the feedback and some of the activities that we did in the visioning event are linked to the indicators for some of these outcomes, particularly the first outcome in terms of resources. So we're trying to tie everything up and make everything that we do, relevant to the process.
Alliance Live. Health and Social Care Alliance Scotland, www.alliance-scotland.org.uk.